Today in Queensland and in Australia, we're seeing an increased risk of getting infected with COVID-19 due to this new Delta variant. So it's really important to reassess all of our status and the position that we're in. And I strongly recommend today that anyone who is aged 60 years of age or over, immediately, if you haven't already, and I know the vast majority have, but if you haven't already, please go and get vaccinated. There is plenty of AstraZeneca out there. There's a couple of small groups that need to talk to their GP and probably do need to be referred for the Pfizer, just a very small number of people. Vast majority, you're absolutely fine to go ahead. So now I've got some specific questions that people have put forward that are very, very sensible. So the first one is, why should people aged 60 and over make an appointment to get their AstraZeneca vaccine? Well, because that will stop you getting sick so that you need ICU or indeed that you might die. We know that people over the age of 60, and as you get older, the risk increases, that you are at risk of getting very sick from COVID-19 and you are at risk from dying from it. So it's really important, just protect yourself. There's also a side benefit that it might reduce your risk of spreading the illness to other people if you are still to get it. So we know people who are fully vaccinated can still get infected and still potentially spread the virus, but their risk of getting sick and their risk of dying is substantially less. And once you get older, you're at a higher risk of getting very ill from this virus. And we're seeing that today in New South Wales. They are seeing that the people in their ICU, the people who are ventilated, are people who have not been vaccinated. So it's really important that you get that vaccine to protect yourself. So the next question. What do people need to understand about TTS? What are the signs to look out for? Well, TTS is thrombosis with thrombocytopenia syndrome. That means clotting, thrombosis to clot, thrombocytopenia without platelets, so they have low platelets. So there are some very, very important things to know about this syndrome. The first one is it is very, very rare. And as you get older, it becomes even rarer. In fact, the risk of getting COVID and potentially dying from COVID is much higher than the risk of getting TTS. The next question, how can people aged 60 and over get their AstraZeneca vaccine? The easiest way for you to get it is, as I did, go to your own GP. Not every GP has access to the vaccine, although that's rapidly increasing. If your own GP doesn't have access to the vaccine, go online onto the Commonwealth website and find who in your local area does. There will be a GP and they will have access, or there'll be a Commonwealth clinic or a pharmacy. Now, anyone who's had one dose of either Pfizer or AstraZeneca vaccine already, you need to go and get your second dose at the right time point of the same vaccine so that you can get maximum protection. That's really important. So the next question's a personal question. How did I feel about getting the AstraZeneca vaccine? Now, the first thing I'd like to put on the table is I got it when it was recommended for people over 50. I'm not yet over 60, although some days I definitely feel like it, but I got it when it was recommended for people over 50. And I was very, very happy to get it because it meant I'm protected against getting severe disease, and that's really important.